Hello, and welcome to another episode of the Many Faces of Cancer podcast. I am your host, Melissa Grosboll, and I have back with me today Claire Margit. And Claire was on last week's episode, and she is a lymphatic specialist. And we did not really get a chance to get into the nuts and bolts of lymphedema. And so I wanted to make sure that I had her back on again to talk more about that, because the lymphatic system and lymphedema are such a huge piece of most cancer diagnoses. And I believe, at least I was very underinformed about risk factors and things to do for that. And I wanted to have a specialist on here to really get in and talk about it. So welcome back to the show, Claire.
Thanks for having me. Happy to be here.
And I do want to do a little disclaimer to start and say that this is not to take the place of professional medical advice. This is an education and informative interview. So if you have any of the risk factors, if you want more information, or if you feel like you may have the beginnings of what could possibly be lymphedema, to please go and see your doctor to have an official diagnosis. We are just going to kind of talk about a high umbrella overview and practical things that we can do to help manage or prevent lymphedema. So,
yes.
All right. With all of that said,
yeah,
I know you have a little bit of a disclaimer yourself that you would like to state too.
I do. This can be, I feel like I interact with clients who are in our practice, at Prism's practice, because everything's gone wrong, lymphatically speaking. But in most cases, things haven't gone wrong or haven't gone wrong yet. And so in this discussion about lymphedema, if you've had the risk factors that we'll discuss, in the next couple minutes and all that, just because you have them does not mean you will develop lymphedema. And kind of piggybacking onto that is that of the people where the worst has happened, where they do have, diagnosed impactful lymphedema, 100% of the time, there was a degree of misinformation or just lack of information provided to them, lack of patient education, which to me implies then that there's a degree of preventability, right? That if they had known that this was possible, or that when you do X, Y, and Z to this tissue, it increases the risk. And then if you go up in the, that maybe things could have been different for them. And that's why I do what I do. That's why I'm here. That's why it's, I'll speak it till I'm blue in the face. And then the other piggyback onto that is kind of the mental health part that I know we touched on even in the last one, I think, that, or like the last recording, that the story you tell about your lymphedema, the diagnosis or the risk factors or everything, whatever, is as impactful as an actual diagnosis. So I do not want people going out there afraid, releasing cortisol and these large stress hormones, creating inflammation, because that actually does a disservice in the end to your lymphatic system. So autonomic regulation, stress management, all those things. So that said, that's kind of my disclaimers. I don't want anyone to freak out, because there are triggering words. You throw around the word irreversible, and that's a trigger.
Freak out.
It was for me.
Right. Yeah. And you're at risk for the rest of your life. Like that can be a little triggering as well.
And a huge grief.
Yes.
Like a very big grief.
Okay. All right. So let's get in. We touched on this on the last episode, but if you could just kind of give like an overview of the lymphatic system, why it's important, what it does, and then kind of the definition of lymphedema.
Yeah. So I define the lymphatic system as an autonomically innervated filtration and transport system that primarily supports what?
I was going to say autonomic means it's involuntary, yes. Like it does it on its own.
It does it on its own. So like your heart beats, right. Like your gut moves, food through, it does it on its own. So autonomically innervated filtration and transport system that primarily supports three other systems: your circulatory, your immune, and your GI, your gut. Okay.
Okay.
So that's what it does. It's moving things, it's transporting things, and it's filtering things. And it does that. The primary, we talk about it as a slurping mechanism. That these vessels, they start as capillaries, lymphatic capillaries, which then turn into vessels, are these straws that are responding to an increase in pressure. So more fluid, more slurping, that kind of thing. But they're doing it anyway. We move about 3 liters of lymph just naturally on our own a day.
Okay.
So that is the system. And almost every tissue in your body has a lymphatic supply. Hugely, I mean, when I learned the impact of lymphatics on gut health and vice versa, gut health on lymphatics, that was a big deal. So yeah.
And then the other thing to say is the lymph system does not have its own pump. So like your circulatory system, your heart is pumping and pushing the blood through the arteries, whereas the lymph system, it requires you moving to actually continue the pumping, correct?
Yes. And when we talk about kind of some practical steps to support your own lymphatic system, diaphragmatic breath is another huge mover of lymph. Half of the lymph nodes in our body, between 300 and 400, are located in your gut. So that's a large number of just lymphatics in your belly. And
Right.
as the respiratory diaphragm and the pelvic diaphragm interact with a deep belly breath, a diaphragmatic breath, that works wonders. I find clients, like, just when they learn to breathe well, they feel lighter. They can feel lymph. It's yeah. But yes, there's no pump. So diaphragmatic breathing, movement, all those things kind of stimulate these straws that are woven in our fascia and in our bodies. And yeah.
Okay. And now kind of give us just a brief synopsis of what lymphedema is, and in the realm of cancer, who is most at risk for developing lymphedema?
Yes. Lymphedema, well, there are 2 different kinds. So first and foremost, only a physician can diagnose lymphedema. So if you are a cancer patient, or anyone who thinks you may be experiencing some swelling, your rings aren't fitting well, you're feeling full, maybe a little achy in your limbs, or, wherever you had the node removed, whatever quadrant, and you go into a massage therapist, and you just say that, like, I'm feeling kind of full. A massage therapist cannot say, even a lymphatic specialist, even a PT, I don't think, can diagnose lymphedema. Only a physician. So that's like, it's a real thing. Yeah. Then on top of that, we have 2 different kinds of kind of diagnosable lymphedema. There's primary and secondary. For our purposes, we're going to hang in secondary, because secondary is acquired. You're not born with it. Primary you're born with. So then secondary is when tissue has been damaged, when something has happened to the body, and there is an acquired pathology of the lymphatic system, a problem. And then there's staging within that secondary. By the time you are even stage worthy, you've probably been diagnosed. You've probably been sent to a PT by your physician, because PT is the first round of defense against that. And then, you're on your way. You have a team, you've got the people, you've got self-care. Self-care is a huge part of lymphedema management. So that's that.
Okay. And then who is most at risk for the secondary lymphedema?
Yes. Node removal and irradiation. Those are 2 of, like, the major factors. On top of that, so you've had nodes removed, you're irradiated, but let's say you have a really sedentary lifestyle. That's another risk factor. Let's say you eat a diet high in sodium and fats. That's another risk factor, because remember we talked about the gut. That's the more fat you eat, the thicker that lymph that's collected in your gut is, and the more sluggish your system becomes.
Gotcha.
Let's say you don't drink enough water. That's going to be a big, that's going to be a big one. Those are all other risk factors.
Okay. And so it doesn't matter if you've had one node removed or 100 nodes removed. It's still,
you are still at risk. Now, the person who's had 5 or more removed is at a higher risk. And I don't know the numbers. I don't even know if there are numbers, but I've had people who have come into the clinic with 2 nodes removed and radiation, and it happened, and this is where like it's such a grievance and such a disservice to the cancer community that the lymphatic system is so understudied and just not understood. Because I mean, I've had discussions with physicians using words that are a daily part of my vernacular, like lymphedema, right? That's just a word that I use a lot, and it's a very helpful word when you're dealing with lymphedema. It refers to a drainage, a part. So within your arm, there are different areas that they're lymphetomes, drainage boundaries, and those lymphetomes drain to specific nodes. But that's not in the vernacular of even a physician. And so they're taking out, they're not mapping what nodes they're removing and connect, and what lymphatome that node drains. And so if you happen to take out all the nodes that receive lymph from that one lymphatome, then that lymphatome won't drain, and that increases the risk of lymphedema. But this is not language that physicians know. This is not. And so how, the hope that mapping could be, that lymphatic mapping with dye and like all of that could be integrated more into protocols, like that you wouldn't remove all the nodes that drain all one lymphatome, but maybe you could, take out, you could even it out. And I know they're also testing for, metastasis, all that.
Right. They're just trying to get rid of the ones at risk, and I won't say they don't care, but it's more about saving a life than saving the lymph, unfortunately.
But then you talk to people and they're like, if I had known, I don't know, like because now they're living with stage 3 lymphedema, and they're like, I don't know what's worse, cancer or this. And some, like some of the more extreme cases, because it's a real managing your lymphedema. And this is where I want to not get like, but it's a full-time job in some cases. You have your self-care protocol, you're managing your diet, you're not, you're avoiding altitude, you're avoiding hot tubs, you're, all these things.
Okay, so I want to kind of get into, so if someone has had nodes removed, they've had nodes radiated, they do not have lymphedema. So can we talk about just some lifestyle support things that people can do to mitigate their risk and to keep their lymphatic system, what they have left, as healthy as possible?
Yes. So I think that lymphatic health is the key to longevity and vitality for all people. So I have kind of the list that I give everyone, like the things I do, the things that if you were my sister, I would tell you to do, that kind of stuff. And those things are as follows. One of the biggest things you can do is that belly breath that we were talking about. So just keeping your visceral lymphatics going, just belly breathing. Now, if you really want the bang for the buck, you can do what we call a deep flow, which is on the inhale of so if you put your hands, I'm doing it right now on myself, but if you just kind of put your hand, you hook in above your belly button and you hook in below your belly button. One hand above your belly button, one hand below your belly button. Yep. And you take a big belly breath. So you should feel on the inhale that your belly is pressing into your hands. So on the inhale, you resist, you press into your belly. You're creating a big pump. On the exhale, you relax and you take you can remove your hands from your belly. So what you're doing essentially is creating a deep flow pump. So on the inhale, you resist. On the exhale, you release 3 times. Okay, that's just a really beautiful. I do that every morning, every night. I do that after fatty meals. I don't have a gallbladder, so that's it's
So whenever you have a few minutes and can think about it, to just,
yep, in
I
the
mean, we should
car.
all be belly breathing anyway, but to actually really focus on it
And adding that
as often
resistance.
as you can throughout the day.
Yep. And the resistance is a big, you can get real bang for the buck by again, on the inhale resisting, on the exhale releasing. So that's baseline. And that also, that kind of ties into the stress management too, right? That stress management is a huge part of managing your lymphatic system. If you are stressed, if you are in a state of hypervigilance or upregulation, that has a really big impact on that autonomic nervous system, which is what we were talking, we talked about earlier, your system that's in charge of the automatic things in your body. Mm-hmm. And so if it's managing threat all the time, then it's not going to be able to manage that slurping as well. Okay. So stress management is another big piece. Movement. We talked about if you have a more of a stagnant lifestyle, then the straws aren't moving. And if the straws aren't moving, then the straws aren't slurping. So it's just get moving. A walk. Swimming is incredible. Because if like a walk, if you've had nodes in your pelvis removed, then that may impact how much you can walk, because you may swell up if you walk. So getting in water, water exercises are incredible. Just laying on your, your training is a little different than mine, but just laying on your bed and doing like snow angel type things, just move. Because I remember there were times in my bone marrow training, like I couldn't move during some of this treatment, or I was post-op and you can't move your chest wall. And so, but if you can just do tiny little things in your wheelchair, on your hospital bed, all of those things, those deep breaths, that really helps support. And then I think nutrition and hydration. I'll do like nutrition, but then like also hydration is a big part of that. And again, we touched on that earlier, that one of the things that the lymphatic system transports is fats. And so if you can eat a diet that is moderately fatty, that will be helpful. Lots of water, all that kind of stuff. Avoid salt, because we know that water follows salt, sodium. So those are all like basic, just you're my sister, you're me, we're taking care of our lymphatic systems. Those are things.
So real quick, you talk about salt. How do you feel about electrolytes?
Yeah, I'm not a nutritionist. I'm not a dietitian. I have not personally, I can speak anecdotally for me and my clients. I have not experienced electrolytes impacting the lymphatic system negatively.
Because most of them are sodium in some form. So, yeah. But I know it's it's healthier than just eating a very salty meal kind of thing.
Yes. Yeah. Okay. And I don't know how the pathways go. I'm not familiar with all that.
That's okay.
But I do know that anecdotally, I have not experienced, and I've had nodes removed, all that.
Right. Okay.
But then so that's daily. Now let's say you are at a higher risk, then I'm gonna recommend that you engage the areas where the nodes were removed or where there was radiation more often, on kind of an as needed basis. And like, so again, by the time you're diagnosed, you probably have a protocol. You have a sleeve, or you've been to PT, you have a self-care protocol. But let's say you're not. Let's say you're just listening to this, you've had some nodes removed, you're irradiated, some of the things that I hear just from my practice is, I wish I had known that when I was in a plane, I wish I had known that up in elevation, when I went, up into elevation, that I was at a higher risk. I wish I had known those things. So what do? I would say that before you get in a plane, you're going into the quadrant affected. So if it's armpit, you've had axillary nodes removed, then you're just either tapping the tissue for a minute to 5 minutes, because that's movement, right? That kind of ties into the movement, or a scoop of some sort. So a scoop, just a nice slow, the way we talk about it is to a 6 count. So on the 1, 2, 3, you're scooping up into the armpit. It doesn't need to be hard or crazy, just you're engaging tissue. And then on the 4, 5, 6, we kind of release the tissue and let it go. That's easier in the armpit. If it's like pelvic nodes, the tapping.
Right, that was the one I was going to ask, if somebody's had colon cancer or something and had nodes removed down there. Is tapping effective?
Absolutely.
Are you getting to it?
Yep.
Okay.
And because it's a one-way system, right? It's going to be important to do the deep breathing before you do the tapping, because what you're tapping will be feeding into the straw upstream. So you want to make sure you've opened up the system with that deep breath, and then go into the pelvis and do tapping and utilize movement. If it feels better to be sitting hinged at the waist and do tapping there, do that. If you've noticed it feels better with your legs elevated or legs, just play around. That's when I teach lymph, when I teach, I really like to instill this idea of like playfulness, that we don't have expectation. We're just sitting with our lymphatics, getting to know them, and they will tell us what they want, because when you're not doing it, when something's not going right, you feel that fullness, or maybe like a little anxiety, because the autonomic part.
Now, is there like a direction that you should be scooping, or, I know like dry brushing can be very helpful with the superficial lymph. Is there a direction that you should be going when you're doing this?
So the sequencing is important. And this is where students like flip out. They're like, wait, what? So
not students, but just somebody at home.
Yeah.
I don't know what I'm doing.
So I would, so there's really great, I think, are you going to attach the resources to?
Yeah.
Okay, great. So first of all, there's awesome visuals on all of those resources.
Okay.
It's
we'll
hard
put in the show
to
notes.
discuss. Yeah. It's hard to, using audio, it's hard to discuss it. It's a one way. Yes, there is a directionality and a sequencing. Everything is going one way to the heart. So you're going to want to move things starting as close to the heart as you can, then moving out and away from the heart, and then back to the heart. So if you're going to be dry brushing, tap, open up. Let's say you're dry brushing your arm. Okay. Open up the system. You're gonna just get the straw going, right? The tip of, let's say there was a little boba in the tip of the straw. By tapping or pumping, you're kind of slurping that boba out. Okay. And then you're going to be starting. The word is proximal to distal, but it's proximal. It's closest to the heart, then the most distant from the heart. And that is the rule in every limb, every part of the body. And like I said, the resources that are linked are incredibly helpful. There's lots of educational stuff. A lot of people like to also start, because we have the 2 ducts up here. Some people, they'll say tap up above your collarbone first before you do anything. That's great advice. I love that. That's beautiful. If you're tapping above your collarbone every morning and then doing your deep breaths and drinking your water and eating your, low fat foods, and shake plates are great. Dry brushing is great. Then you're going to rebounding. Yep. Rebounding, all that. And if you're at a higher risk, then do the pumping before the high risk activity. And this is like 1 to 5 minutes, depending on how it feels to you, how your body tolerates it. So 1 to 5 minutes before the riskier activity, or and then hourly during the riskier activity, and then like I would say twice in the hour following the
Okay.
riskier activity. And if you do notice rings swelling, like stage 0 type stuff, get to a practitioner like soon.
Okay.
um and yeah.
Now, do you recommend for people at high risk, if they're flying or going up to altitude, that they wear a compression sleeve like during that activity?
I would, yeah.
Okay.
I would, if it were me, if I had had axillary nodes and my tissue had been irradiated, I would wear, because, and this is part of why physicians hate the lymphatic system, is because it is so delicate and so subjective. Some people, it's so hard to study. And so one person can fly. I mean, I've had people who've flown and nothing happened. And then because maybe they ate a cheeseburger before one flight, or maybe they took, maybe a softball hit their chest or their knee or whatever, and so there's a little more edema, there's a little more swelling or scar tissue at the site, the affected site, than there normally is. Just it's like these perfect storms, and then they can develop lymphedema. So I would absolutely, if it were me and I had had axillary nodes and they had been removed, I had nodes removed and irradiated tissue, I would wear a compression garment every flight I took.
Okay. All right. And then so I know they're going to get information from their PT, they're going to get information from their doctor if they've been diagnosed, but what kind of things do you recommend for ongoing, I guess, maintenance once someone is diagnosed? Just stay with like stage 1 lymphedema to help to be able to manage and make life bearable.
Yeah. I think that really that hooks into the mental health part a lot, is, and regularly I will recommend or refer out to psychotherapists for people newly diagnosed, because it is a very impactful diagnosis. It can be a very impactful diagnosis. So mental health is getting on your mental game, understanding that it's not a death sentence, that it's manageable, that self-care is going to be a part of your life forever, though. So doing the scooping, and this is where it's depending on the surgeries you've had, where the scar tissue is, the type of radiation, is there visceral involvement? It's very variable. And so finding a practitioner who can help you map out your own system and help you create a self-care protocol is the just ultimate self-care, thing. Not everyone has access to that. So manage your diet, move the tissues as is loving, pump, dry brush if you need to. Some people really benefit from a more direct approach like gua sha, like the scraping. And it is, again, so variable. You got to do your, look at the resources, visit a lymphatic specialist, even if it's just once, schedule a discovery call, get in there and get taught. And then, regularly at the practice, we see people 3 times and then never see them again. So that is a very, between PT and manual lymphatic drainage, what we do at Prism, you can have a fine life.
And so when you see clients, and I'm hoping there are other U's for people who are not in the Denver area. Mm-hmm. So do you, is education a part of your treatments? So you're doing the lymphatic drainage, but I'm assuming you're also teaching them how to manage it themselves, which is why they, a lot of times never need to come back and see you.
That's our goal, right? As practitioners, we don't want to see you forever. We want you.
Most of them, the good ones anyway. Yeah.
There you go. We want to equip you with the information about your lymphatic system so you can support your lymphatic system. So when you come to Prism, my practice, We have posters on the wall. We're talking about, we're teaching every step of the way. And a lot of times we'll ask, like, how involved in this do you want to be? Because some people come and they just want to be drained. They just want to be treated. I say drained, like drained.
They want their lymphatics drained.
Right. They want it. They want less fluid. But our disclaimer is like, you're an active part of this. Self-care is a huge part of this, and we're happy to drain you and support you and to do all of that. But the more information you have, the better equipped you are to support your own system. So yeah, we use models, we use posters. I almost said lobsters. we use posters. We're teaching you how to do it yourself, what the proper pressure, all of that. And I'm actually, because the demand has been really increased lately, I would love to see more practitioners, myself included, like have actual just educational visits where you go and you learn. And so I think I may start offering that after this, because I teach massage therapists, but how much more impactful to teach clients.
Right. So they can do it. They can take control of their own
without having to schedule a full 90-minute, just come in, learn, and you're good.
So if someone is looking for a practitioner, and again, like if you're in the Denver metro area, please contact Claire, Prison Body. We will put her contact information in the show notes. But if they're not in the Denver area, is there a specific, like if they're Googling, is there a specific thing that they should be looking for to know that someone is specialized in this and really knows what they're doing, instead of a massage therapist who took a weekend class and, is trying to do it on her own?
So yes, so manual lymphatic drainage is kind of what you Google.
Okay.
So manual lymphatic drainage. Now there are, within that umbrella, many types of manual lymphatic drainage. You're going to want someone who also works with nervous systems. So like the more, if they offer cranial sacral as well, that's awesome. If they've taken visceral classes like Barral, Barral, that's another bonus, because then they're in your gut too. And if your gut is working, then your lymphatics are working. There's also, if you look at, and I can send you the names of these because they're all like European osteopaths. So they're kind of hard. But go to Chickley Institute, Chikly. A Chickley trained lymphatic therapist has a little bit more, has an up on just the regular VODR MLD therapists. So Chickley, visceral, cranial sacral. I would steer clear of people, and I have students ask me this every year. What about like if you YouTube lymphatic drainage, there's this like Brazilian type or these like really rough, they're they're doing really rough things. And again, like, are you moving tissue? Yes. So will you be moving lymph? Yes. But they are not trained to work with oncology. That's like more of like the plastic surgery. So along with that, make sure that your massage therapist has taken an oncology course. Are they oncology trained? Those are all things that oncology, visceral, Chickley.
And could someone like reach out to you, just contact you and, tell you what area they're in, and, maybe you can have a referral for them as well.
Yep. I have a 15-minute discovery call option on my site. And awesome. So I'm happy to do that for anyone. It's the real deal. And you don't want to mess around with it.
That's awesome. Awesome. Well, thank you so much, Claire, for coming back and really getting into this, because again, this is so important. And I think I talked about last week that nobody told me that lymphedema was even a thing. And I found out when I was training for my own cancer certification course as an exercise specialist that this was even a thing. So I don't know if it was just my experience or if people in general are not always being told. So this information is so important, and I really appreciate you coming back and diving deep into it, because we all need this stuff. And knowledge is power, but also know that the risks for the most part are generally low. Just a little bit of management, is sometimes all that you really need.
Yes.
Okay. Awesome.
Yeah. Thank
Well,
you.
thank you again. I appreciate all of this information, and I will have all of your information and these resources that you've given me in the show notes, so people can figure out their own journey. And I love that 15-minute discovery call with you as well.
Good.
All
Thank
right.
you.
All right. Have a great rest of your day.
You too.
Bye-bye.
Bye.